One of the common problems that we're seeing very frequently now in our practice is patients who come in with old silicone injections to the buttocks, and it could be a real mess. Jonathan, why don't you tell us a bit about this?
So Jason and I practice in South Florida, and we're right by South America, where a lot of unethical practitioners are putting silicone or other foreign materials.
And we don't even know what they're injecting sometimes.
Yeah, all kinds of horror stories.
It's not South America, it's everywhere. It's Newark, it's all over the place.
Yeah, so when you have these materials in the tissue, it creates a real problem.
Mm-hmm. Right. And what do you do about that, Barry?
Well, as Jonathan just said, it's a real problem because it may be okay the first few years, but then it starts smoldering, it can get hard, it can get infected, it can migrate, a whole host of things.
You can see some big open wounds in these patients, like a real mess.
Oh, everything. And some of them, it's so bad, one girl couldn't sit down for 4 years.
And it affects their health.
Oh, and then
not just cosmetic.
And then it affects their immune system, so they're fogged, they can't think, it's just...
All right, so one of these patients comes into the practice, their butt's a mess. How do you work this up? What do you do?
So the first thing I ask them to do is get a CT scan without contrast so we can actually map out and see. And there's two groups of what we're gonna see. We're gonna see concentrated rock hard areas, and then we're gonna see migrated areas. So on the migrated areas, we'll use the Vaser, which is ultrasonic liposuction, to break it up and get it out through a small, tiny incision.
So that gets rid of the peripheral.
The peripheral.
Stuff, okay. And what do you do for the big rock hard?
We have to make an incision. It's not the prettiest thing, but we need to get it out correctly.
Cut it out.
Cut it out.
And you put it back together.
And then put it back together and make it look as good as we can at the time.
And what patients need to understand from that first consult is we tell them, this very well can be a staged kind of procedure, staged treatment, where you're debulking that bad stuff and vasering it, and then you have to go back and possibly fill in all the contour irregularities using their own fat as fat graft.
So when these come in, about what percentage needs one stage and what percentage of the patients need a couple of stages? Half?
You can't say. Everybody's their individual.
You try to do it in one stage, but sometimes you bring them back, you said, in 6 months, and you kind of tune them up a little.
I would say it'll depend on what their complaint is. Some of them come in with truly functional complaints. They can't sit down. Some of them come in where there's just discoloration in the skin that's bothering them, or there's that superficial lumpiness. So I would say it just depends on what
some just need the liposuction only.
So these patients, we have options to correct these big problems. So if you have this kind of problem, please, give our offices a ring. We'll absolutely be able to help you. And for more information, please go to theplasticsurgerychannel.com.